This is a demonstration video on how to supine your prone patient using the MaxiMove Lift and hanger bar. Gather supplies. You'll need a repositioning sling, a flat sheet, patient gown, electrodes, incontinence pad, pillowcases, and pocket slider. Note, for bariatric patients, they will require a bariatric pocket slider and an additional clinical support person. The turn team leader will direct the team. Note, the primary nurse or a member of the team will need to be included with the turn. Begin by positioning patient's arms at side. Flatten head of bed followed by feet. Raise bed to a workable height and lower all side rails. The primary nurse will direct the team to disconnect or remove any unnecessary tubes or equipment on the posterior aspect of the patient. Pull sheets and sling tight under the patient in order to remove any wrinkles. Check that patient's arms are at side with bum to bum. Position the bar parallel over the patient and attach the repositioned sling the patient's lying on using all white hooks to the upper and lower bars. Ventilator side should be attached first. Note, for wider patients, gray hooks may be utilized. Time out with your team, making sure everything is in place before going into the supining process. Lift patient in the air high enough to remove prone pillows and sheet. Place sling, sheet, and incontinence pad onto mattress. Place pocket slider from shoulder to buttocks onto the sheet, positioning it slightly closer to the ventilator side. Move patient to edge of bed on ventilator side and lower patient onto bed. Remove sling straps on left side. Position straps near patient's feet, rolling sling downward, and tucking under patient. Begin lifting patient into the air. Clinical support on the ventilator side will pull on the sling while the clinical support opposite of the vent will use the patient's sheet to safely guide the patient's turn supine. Remove sling attached. Position the bar parallel over the patient and attach the repositioned sling the patient's lying on using all white hooks. 6 upper, 6 lower. Note again for whiter patients, gray hooks may be utilized. This will allow you to lift the patient into the air to place pillows or wedges under their side for their turn. Lower patient onto bed. Time out with your team. Primary RN will assess patient and RT will assess airway. Pull heels with pillows or place EHAB boots. Elevate arms onto pillows. Raise head of bed to 30 degrees. Raise upper side rails. Place bed in lowest position with alarm on. Primary nurse will reconnect any tubes or equipment. This concludes our supine video.